Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas. Hey everybody, it's Dr. Reiser. It is Whiteboard Wednesday, and today I have a PSA about elderberry. And I'm going to discuss today why there is a bunch of people that should not be taking this. And those specifically are people that have autoimmune diseases. So if you are anybody that has rheumatoid arthritis, psoriasis, type 1 diabetes, celiac disease, or you just suspect you have an autoimmune disease, you should not be taking this. It's going to make things worse for you. So if you don't have an autoimmune disease, my recommendation would be to take this if you do have the flu. Obviously, we know a bunch of people, whether on the news or in blogs, that are taking elderberry because it actually shortens the amount of time that you have the flu. So very good to take in cold and flu season. However, I would only take it when you have the flu. You do not want to take this every single day because it is pro-inflammatory. It increases your immune response. So when we're thinking about autoimmune patients that already have an overactive immune system and are chronically inflamed, you don't want to improve or push inflammation in your body. So this is something you have to avoid. Stop taking it if you are. So I'm going to go down through and link in the caption here the actual study that describes this, and we're going to talk about it here right now with the diagram. So before we even know about elderberry, we have to know what happens with the immune response. So let's take a look at that first. And basically, when you have an immune response, you're looking between a vein and your lymphatic system. So you would have a vein running across the top here, and you have your lymphatic system at the bottom here, and in between you have tissue. So what occurs is your veins are going to carry immune system cells like macrophages, neutrophils, and so on and so forth. They will go into the tissues, and then they clean up everything, and the lymphatic system takes it all away. So let's say that we do have some sort of bacteria in the tissue, or maybe we have some damage. It doesn't even necessarily have to be some kind of organism. So let's say we have that here. Well, what will occur is you have macrophages, and we're going to use purple for that. We have macrophages that are signaling your body to tell you that you have some sort of breakdown or some sort of bacteria. And they're going to be here, and they'll send a signal up, and this creates adhesions at that vein site. And what these are going to do is signal neutrophils to go down now, and these neutrophils will then take care of the bacteria. So the neutrophils will use black here, and these neutrophils are going to come down through, and they will engulf this bacteria or this damage, so that's why the inflammation comes. So that's your immune response. Pretty simple. It's actually a lot more complicated than this, but just to make things simple for this video, this is what occurs. So these signaling pathways, or these signaling systems here, which what we have this signal coming from your macrophages all the way up through here, this is what elderberry promotes. It tells your body that you need to release neutrophils, okay? And it tells your body that you need to do this to get rid of whatever threat is in the body. The problem with this is that these neutrophils, once they engulf bacteria, they have to have these macrophages, if they're floating through here, we'll use our purple again. They have to have these macrophages coming in from the vein to go down, and they then engulf the neutrophil to get rid of it. So once the neutrophils, goes and attacks the bacteria, gets rid of it, you have to have macrophages that then get rid of the neutrophil as a waste product. So it does that, takes it into the lymphatic system, and then it's gone. However, if you have too much of this going on, too much pro-inflammatory from your elderberry, you don't have enough to keep up as far as getting rid of these neutrophils. So the waste products begin to increase. And that is the inflammation we're talking about in an autoimmune individual. Too much inflammation leads to autoimmunity. Too much immune reaction leads to autoimmunity. So if you are somebody with an autoimmune condition and you cannot get rid of the immune system cells as fast as you are making them, you most certainly cannot take elderberry because it will make it worse. Okay? So that's a little video today, a little bit difficult in comparison to what we're normally talking about, but you can search this at what's called a cytokine response. And really there's tons of videos similar to the one I just drew up here, but it goes a lot more in depth than this. But if you are somebody that has an autoimmune disease, like I said, rheumatoid arthritis, celiac, type 1 diabetes, Hashimoto's especially of your thyroid, I have a ton of patients coming in that's asking, can I take elderberry? Can I take elderberry? No, do not take it, because it's going to make things worse for you. If you are somebody that does not have an autoimmune disease, by all means take it, but you want to take it during the time that you have the flu or whatever you're trying to help your immune system fight off. Because as we just seen right here, if you are somebody that's not sick, why would you want to make yourself more inflamed constantly, every day? And I've run into many people that say, yeah, I take this all through the winter months. Do not do that. So that's a little PSA today. Like I said, I'll link the article here that explains, or the research study that explains what is going on in this specific response. And then obviously watch out for the elderberry if you have autoimmune disease, and if you're somebody that doesn't, only take it when you're sick.